The first case of a deadly and mysterious virus that until now has confined itself to the Middle East has turned up in the U.S., in Indiana. It's a respiratory virus more lethal than the flu. It's called MERS. It was first discovered 2 years ago in Saudi Arabia. Today, the CDC said it was only a matter of time before it reached this country. Our chief medical editor, Dr. Nancy Snyderman, has our report.
Healthcare officials are working to track down people who recently traveled the same route as a man the CDC says has tested positive for the deadly Middle East respiratory syndrome virus. On April 24th, a healthcare worker traveled from Riyadh, the largest city in Saudi Arabia, to London's Heathrow Airport. From there, it was on to O'Hare in Chicago. From Chicago, the man took a bus to Indiana. And on April 27th, he felt ill with shortness of breath, coughing, and fever. On April 28th, the patient went to the emergency room at a community hospital in Munster, Indiana. It was there he was diagnosed, isolated, and today remains in good condition. Although a potentially dangerous virus, experts say the general population is really not at risk.
There has not been a clear case of person-to-person transmission outside of the healthcare setting yet. So I think we need to keep this in perspective.
Health officials said the virus originated in the Middle East, maybe in camels. It then infected human beings and has spread to several European countries. It's estimated to have infected more than 370 people in Saudi Arabia alone, resulting in more than 100 deaths. There is no specific treatment, cure, or vaccination for this emerging illness. This virus is not as contagious as influenza. You can't get it with just close contact. And not everybody who's exposed is going to come down with the infection. But it is a reminder in this ever-shrinking world that emerging viruses and bacteria are only a plain ride.